Hosford.
Excuse me, cough. You have overstayed your welcome. Me cough no kill you. Check out. Aha! Large man. You dey cough. You sabi person where they cough. You reach 2 weeks or more. Make you check that cough.
My correct people. I know say I don't sit down gidigba radio to hear the better matter we carry on giving out today on top the program TB Tori. My name na Abdul Fattah Tori.
In case you no sabi TB Tori, na program where we dey check this disease whether they call tuberculosis well, wetin dey work am, how they take waka around the country, and how we go fit take comot am pata for this country wey go better for all of us.
And for this program, every time I dey try to remind you, I say Tori and Otori e take side.
My name na Ufoma Eguri. I say I don't know wetin they do this man for here. This program na courtesy of KNCV Tuberculosis Foundation Nigeria.
It be like this small time when we spend, so you don't go there big.
Watch me, my brother. Watch me. I've not started. Now, I beg go follow us for social media as the hot, for Facebook for KNCV Tuberculosis Foundation Nigeria, and for Instagram KNCV Nigeria.
You think I'll let you learn? Hear me now.
Come on.
For the program today, we get one kind serious focus. We go talk for English, make it settle for our mind first.
What if they try to talk? We say the topic of today.
Heavy.
It is hefty. So make we talk for English. Pharmacovigilance for DRTB treatment. First of all, I beg make we first explain something. You see, it gets some kind of wicked TB. We don't take for body. We will come the bounce medicine. You go give a medicine, the medicine no go dey work the way it's supposed to work. Now that one now that they call drug resistant TB. You get back? Now, for inside that drug resistant TB, it means say they go gas to treat am with different combination.
Make it for take work. Because if you use the regular one, it go bounce.
Yes. Now the point be say inside that drug resistant TB, it gets JS1 level, will be the normal drug resistant TB.
It just be like class.
Yes.
Secondary school. Then you can't get JS2 level.
Exactly.
When it be say na multi-drug resistant TB, now be that one.
Yes. You can't get SS3. That one's it dey sad to talk, but it be like that one. I'm serious pass. That one dey for SS3.
Graduate.
Yes. Hey, graduate Abdul. Anyway, that one that they call them extensively drug resistant TB.
See as the English say heavy.
I'm telling you. So the point be say for inside the matter of this kind of hefty tuberculosis, they got to mix drugs to take treatment.
As this matter be so, if you ask me, we no need to talk too much before una go feel understand. Say this kind TB not be normal TB.
Yes, them guys tackle am with special focus. And now the idea of to say make people fit to monitor or to focus on the drugs where they give for this special kind TB. Now they call vigilance. So when you hear pharmacovigilance, it means vigilance of pharma.
That is to say, they shine their eye. That be the vigilance.
Yes.
The pharmaco there, now the pharmacy. Yeah, that is
the
medicine.
Wisdom. Sense no go kill us. We are too sharp. Anyway, the putting eye for those kind mixing of medicine, make it not go spoil the person where they take the medicine.
Now we put eye on top today.
Yes.
Our guest on top this program today, person where we say I like to call his name because this name is smooth for mouth. Pharmacist Cassandra. Cassandra Elagbaje.
Yes, she be the senior technical advisor for logistics and pharmaceuticals.
English no sweet for your mouth.
Avoid me.
Logistics and pharmaceuticals for KNCV.
I bet make una chook here because na sweet English with big words she go dey use. So try listen, make you for fit understand well.
Make you check that cough.
Good morning, listeners. My name is Cassandra Elagbaje. I'm a pharmacist and I work with KNCV Tuberculosis Foundation as the Senior Technical Advisor, Logistics and Pharmaceuticals. Today, I'm going to talk to you about pharmacovigilance in DRTB treatment. If you have been following this program, you will already know a little about tuberculosis, its symptoms, diagnosis, treatment, and management. Introduction to DRTB. So what I'm going to do now is I'm just going to let you know what it is, tell you the definitions, and then just a brief introduction, and then we can go into pharmacovigilance. So DRTB, drug-resistant tuberculosis, is defined as TB in whose infecting organism is confirmed by the laboratory not to respond to common anti-TB drugs. Its mode of transmission is similar to that of TB, and it's generally a global health threat with high risk of disease and death. It is a major public health concern in many countries, including Nigeria, and it's an obstacle to effective global TB control efforts. So let's look at the treatment of DRTB. Effective treatment of TB, including its drug-resistant forms, which is DRTB, relies on the use of several medicines administered in combination for an adequate duration. Significant progress has been made in recent years in identifying more efficacious, safer medicines and shorter treatment regimens. Classes of anti-TB drugs. The national DRTB drugs are drawn from the array of existing World Health Organization recommended anti-TB agents, and they are broadly categorized into two sections. The first line drugs, which comprises of isoniazid, rifampicin, pyrazinamide, and ethambutol. And then we have the second line drugs, which has a whole new grouping system of anti-TB drugs. I'm not going to go into this because, as I said, basically, we just want to know what pharmacovigilance is, but it's important to give you a history. The World Health Organization in 2016 regrouped anti-TB medications to also accommodate some newer drugs which have come in, which are bedaquiline and delamanid. And this also guides selection of individualized patient regimens with these drugs. Okay, so that is a brief introduction to DRTB. Now let's look at what pharmacovigilance is, since this is what we're talking about today. Pharmacovigilance is the science and activities relating to the detection, assessment, understanding, and prevention of adverse effects or any other drug-related problems. So basically, as in layman's terms, when you hear pharmacovigilance, you know there's pharma, that's drugs automatically, and then vigilance. This is when everybody's been on the alert. They're looking out to see what is happening. So pharmacovigilance, basically drug and being vigilant what is happening with drugs when they're being administered into the population and patients are using these drugs. So we look at the approaches to pharmacovigilance. There are two main approaches of monitoring and reporting drug safety. These are spontaneous and active pharmacovigilance. Spontaneous reporting is called passive or voluntary reporting. This is the most common form of pharmacovigilance. In some countries, it's mandatory. For Nigeria, it's mandatory for marketing authorization holders, but it's a professional obligation for healthcare providers. And in this form, you also encourage patients and general public to report any safety concerns. This is usually done on a yellow form and is reported to the Drug Regulatory Authority in Nigeria, which is NAFDAC. But this is a very low rate of reporting. And then you have the active reporting. This is different from spontaneous because it is proactive. Efforts are made here to detect adverse events. You follow up any adverse events, and this may also continue after treatment ends. Examples are when the medicine has long life after it's been used. Adverse events are detected here by asking patients direct questions and actively screening their records. And this form of pharmacovigilance, which is used in treating patients in TB, is called ADSM. So I'll go into a definition of what ADSM is. ADSM is defined as the active and systematic clinical and laboratory assessment of patients on treatment with new TB drugs, novel MDR-TB regimens or XDR-TB regimens to detect, manage, and report suspected or confirmed drug toxicity. When we say MDR-TB, this is multi-drug resistant tuberculosis, and XDR-TB is extensively drug-resistant tuberculosis. So we look at the key terms in ADSM so you have a better understanding of what it is we're talking about. There are adverse events, and this is defined as any untoward medical occurrence that may present during treatment with a pharmaceutical product, which may not necessarily have a causal relationship with the treatment. So the patient can have an event, a drug was taken at a time. You have to look at everything around the patient to determine what it was that caused that adverse event, and if it's possibly the drug or any other drugs that are being taken. Then we look at an adverse drug reaction. This is a response to a medicine which is nauseous and unintended, and which occurs at doses normally used in humans. We have a serious adverse event, which is an adverse event which either leads to death or is life-threatening. It can lead to hospitalization or prolong an existing hospitalization. It can lead to persistent or significant disability or to a congenital anomaly. An SA does not necessarily immediately result in one of these outcomes, but that requires an intervention to prevent it from happening. Severe adverse events. An adverse event of maximal intensity as judged by the patient and or the clinician. At times, this assessment is based based on laboratory or clinical tests. Different scales exist to determine the degree of severity, and the simplest being mild, moderate, or severe. So that's how it is classified. Adverse events of clinical significance are adverse events that are either serious, they're of special interest, it may lead to a discontinuation or change in the treatment, or is judged as otherwise clinically significant by the clinician. Now, ADSM is used to monitor, uses, the cause, and manage adverse events in patients who receive TB medication or are on a treatment regimen. With the introduction of new drugs and regimens, patient safety is monitored through this ADSM and is an essential part of TB patient treatment, patient adherence, and patient management. In ADSM, besides the reactions that are regularly reported, adverse events are also stimulated as part of a patient monitoring plan using a set of questions from both laboratory and clinical tests done before, during, and after treatment. The records from active drug safety monitoring makes it possible to determine the exact number of patients monitored, the extent of exposure to a drug, and this helps in evidence-based prescribing by healthcare providers and often leads to pharmacovigilance policy decisions in regards to TB treatment. So let's look at the importance of ADSM and why are we drug safety monitoring? With the introduction of new drugs and regimens, patient safety is of utmost importance. Adverse events are expected in more than 80% of patients during treatment for Drtb. Even mild and common events that can affect treatment outcomes. Some of them are adverse events that are life-threatening, for example, renal failure. The patient is on a lot of drugs. Some adverse events can cause permanent disability, for example, hearing loss, and they can generally lead to a reduced quality of life, treatment interruption, avoidable morbidity, and added cost to the treatment service of the patient. So ADSM consists of 3 components, which are clinical monitoring, and as I've said in the definition, active and systematic clinical, bacteriological, and laboratory assessment during treatment to detect drug toxicities and adverse events. So basically, what pharmacovigilance is more interested in and what it is there for is to ensure patient treatment outcomes are safe for the patient, and it's all about the patient being treated and coming out with the best results for the patient. So basically, it's important, obviously, to give the patient the drugs that are needed to alleviate their symptoms of any sickness, but it's also important to monitor to ensure that is the best outcome for the patient. Thank you very much.
Make you check that cough, check that cough. Check out, excuse me, check out. You have overstayed your welcome. Aha!
Jerry Hosford.
You dey cough. You sabi person where they cough. It reach 2 weeks or more. Make you check that cough, check that cough. You dey cough. You sabi pikin where they cough. It reach 2 weeks or more. Make you check that cough, check that cough. Dial that 3340, 3340. Dial that 3340, 3340. Tuberculosis no need to kill you. No need to dial that 3340, 3340. Dial that 3340. 3340.
English.
These people, they try their best to make sure say they get channels to monitor the effect of all this kind strong medicine where they give patients we get this stubborn TB where they refuse drug. No be better thing be that.
Na better
Na
thing.
better thing be that.
We no go until we tell una say if you dey feel cough for 2 weeks when you don't treat am and you no gree go, e better make you go check am.
Abeg, no let am spend months for inside your body before you go begin dey run around. Beg, check am.
Question for the day.
Come on. Our question for today, where you go fit to win a roof recharge card now. Wetin Drtb mean?
Simple, Dr. TB.
No mind am, you go fail am. Wetin Drtb mean?
Carry waka
Abeg.
go our Facebook page, join body for all our social media platforms. But for Facebook, now you go answer this question. Then you go get all your family members and your friends. Then make they go like, and the person will get the plenteest like. Now you go win our recharge card for
The
today.
Facebook page na KNCV Tuberculosis Foundation Nigeria.
Now one word though.
Yes, so Titi Rich when waka come again next week to congress your speakers. My name na Ufoma Iguriase.
And for TB Tori, my name is Abdul Fattah Tori.
Make you check that cough, check that cough.